"She's too fragile for the ER," the chief trauma surgeon scoffed, watching the quiet new nurse step back from a screaming patient. He thought she was terrified. He had no idea she was simply calculating the room's threat level with the cold, lethal precision of a DEV-GRU medical commander. The fluorescent lights of Seattle Presbyterian's Level 1 Trauma Center hummed with a sterile, relentless energy. It was a Tuesday evening, the kind of shift that lured civilian medical staff into a false sense of security. In Trauma Bay, 4 Dakota Hayes stood quietly by the supply cart, her hands folded neatly over her navy blue scrubs. She was 32, with sharp, observant gray eyes, and a demeanor so entirely unremarkable that most of the hospital staff forgot she was even in the room. That was exactly how Dakota wanted it. Swab, hemostats, and for God's sake, someone get me a nurse whose hands aren't shaking, Dr. Mitchell Trent barked, tossing a bloodied piece of gauze onto the surgical drape. Mitchell Trent was the hospital's golden boy. At 35, he was the youngest attending trauma surgeon on staff, a man whose undeniable surgical brilliance was eclipsed only by his monumental ego. He thrived on the adrenaline of the emergency room, playing the role of the undisputed general of his domain. He demanded perfection, loud communication, and absolute deference. Dakota stepped forward, her movement smooth and deliberate, sliding the hemostats directly into Trent's waiting palm before he even had to look up. She didn't speak. She didn't tremble. Finally, Trent muttered, clamping off a minor bleeder on the patient's forearm. The patient, a reckless motorcyclist who had taken a spill on Interstate 5, was heavily sedated. "Hayes, isn't it you've been here, 3 weeks? You need to move faster. Trauma doesn't wait for you to find your courage. If you can't handle the sight of arterial spray, I hear the pediatric ward is looking for someone to hand out lollipops." Dakota's face remained a perfectly blank mask. "Understood, doctor." She didn't tell him that the arterial spray from a ruptured radial artery barely registered on her pulse. She didn't mention that 3 years ago, in a pitch-black, dust-choked compound in the Helmand province, she had clamped a shattered femoral artery with her bare hands while taking incoming enemy fire. She didn't tell him about her classified file at the Pentagon, or the fact that she was the first female medical officer attached to a Tier 1 Naval Special Warfare Development Group, SEAL Team 6. To the HR department at Seattle Presbyterian, her heavily redacted DD-214 simply read Navy Medical Corps. Honorable discharge. Dakota stepped back into the shadows of the bay as Trent finished his suturing. The other nurses exchanged sympathetic glances. They pitied her. To them, Dakota was the timid new hire who had transferred from some sleepy private clinic in the Midwest. She spoke softly, never engaged in the aggressive banter of the trauma pit, and rigidly adhered to hospital protocols which Trent often bypassed in his cowboy moments of glory. "Don't let him get to you," whispered Nurse Ramirez, a veteran of the ER, as they wheeled the stabilized patient out. "Trent's a shark. He smells blood in the water. He thinks because you're quiet, you're weak." "I'm fine," Dakota replied, softly, offering a polite, practiced smile. "He's just passionate about his work." She retreated to the nurse's station, pulling up a digital chart. As she typed, her mind briefly drifted. The civilian world was loud. In the military, in the truly dark corners of special operations, silence was survival. Panic was a luxury they couldn't afford. Here, every minor laceration was treated with a cacophony of shouting, rushing, and performative urgency. Trent's theatrical displays of dominance exhausted her, but they also amused her. He was a man who played at war in a sterile room with unlimited supplies, backup generators, and a legal team waiting in the wings. Later that night in the break room, Dakota sat alone with a cup of lukewarm black coffee. The door pushed open and Trent walked in, still wearing his surgical cap, his scrubs dotted with iodine. He poured himself a cup, glancing sideways at her. "You hesitated today, Hayes," he said, leaning against the counter. "When that biker came in, you stood back for a full 10 seconds before prepping the tray. What were you doing?" "Praying." Dakota took a slow sip of her coffee. "I was assessing the room, doctor. The patient was hemodynamically stable. The airway was clear. The bleeding was venous, not arterial, despite the volume. There was no immediate threat to life. I was ensuring the sterile field wouldn't be compromised by the panicked EMTs rushing the gurney." Trent scoffed, shaking his head. "Assessing the room. Right. Listen, Hayes, this is a level 1 trauma center. We don't have time for philosophical pauses. You act or people die. I need people in the trenches with me who have ice in their veins, not desk jockeys, who freeze when the monitor starts beeping." He dumped his coffee into the sink and walked out, leaving the door to swing shut behind him. Dakota sat in the quiet hum of the break room refrigerator. She looked down at her hands. They were perfectly steady. They had been steady when she extracted shrapnel from her commanding officer's chest in the back of a violently banking Black Hawk helicopter. They were steady now. She wasn't freezing. She was waiting. But the civilian world didn't know the difference between fear and discipline. The illusion of civilian safety shattered exactly 4 days later on a miserable rain-slicked Friday night. At 9:14 p.m., the red trauma phone at the main desk rang. It wasn't the standard ringtone. It was the emergency override alarm signaling a mass casualty incident. The ER went dead silent for a fraction of a second before the charge nurse slammed the receiver down her face, entirely devoid of color. "Listen up," she yelled, her voice cracking. Multi-vehicle pileup on the I-90 bridge. A semi-truck carrying industrial solvent lost control and plowed into stopped traffic. Multiple explosions. EMS is reporting at least 30 criticals en route. ETA is 3 minutes. Clear the bays. Call in every attending on the roster. The standard orchestrated chaos of the ER instantly dissolved into sheer panic. 30 critical patients at once was a nightmare scenario. It was mass casualty. Dakota felt a familiar icy calm wash over her. Her heart rate actually dropped. The adrenaline didn't make her jittery. It focused her, narrowing her world down to physiology, physics, and time. This was her element. The sterile hospital melted away, replaced by the instinctual rhythm of triage. Dr. Trent burst out of the staff elevator, his face flushed, barking orders. "I want bays 1 through 6 prepped for the worst. Get the massive transfusion protocols ready. Who's the triage officer?" "You are Dr. Trent," the charge nurse shouted back. "Dr. Weber is 10 minutes out. You're the senior attending." Trent swallowed hard, a flicker of genuine apprehension flashing in his eyes. He was a brilliant surgeon, but he was accustomed to dealing with one mangled body at a time, surrounded by a dedicated team. Managing a catastrophic influx of 30 dying people required a completely different skill set. It required ruthless prioritization. The automatic doors blew open. The night air rushed in thick with the smell of diesel-charred metal and burnt hair. The paramedics flooded the corridor, screaming for help, pushing blood-soaked gurneys. The noise was deafening cries of agony, the screech of metal wheels, the relentless wail of ambulance sirens outside. "Over here!" Trent yelled, directing the first gurney into Bay 1. "What do we have?" "Male 40s blunt force trauma to the chest, possible crushed pelvis," the EMT shouted. "Pressure is tanking 60/40. Get him on the monitor. 2 large-bore IVs," Trent commanded. But before the nurses could even hook up the leads, 3 more gurneys crashed through the doors. "Dr. Trent, we need you here. She's coding," a resident screamed from Bay 2. "Wait, I can't." Trent pivoted his eyes, darting frantically between the screaming patients. The volume was too much. The visual input was overwhelming. Dakota was already moving. She had bypassed the supply carts entirely, her hands full of tourniquets, chest seals, and trauma shears. She didn't walk. She glided through the chaos, her eyes scanning the incoming wounded with terrifying speed. She wasn't looking at their faces. She was looking at the mechanism of injury, the color of their skin, the rise and fall of their chests. A paramedic wheeled in a young man in his 20s. He was thrashing violently, his clothes soaked in dark, oxygen-deprived blood. "I can't stop the bleeding," the paramedic panicked. "Deep laceration to the right thigh severed the artery. I tried holding pressure." Trent rushed over his face, pale. "Get a pressure dressing on that Page ortho. Tell them we have a vascular emergency. We need him in the OR now." "He won't make it to the OR. His pressure is bottoming out," Dakota said, her voice cutting through the screaming like a serrated blade. It was the first time she had spoken above a polite murmur since she started working there. It wasn't the voice of a timid nurse. It was the voice of a combat commander. "Excuse me," Trent snapped, spinning on her. "Do not question me, Hayes. Put a pressure dressing on it and step back." "You're freezing up again. If you can't handle trauma, get the hell out of my bay." Dakota didn't even look at Trent. She looked at the patient's graying face. The thrashing was a sign of late-stage hemorrhagic shock. His brain was starving for oxygen. She completely ignored the attending surgeon. "Hold him down." Dakota ordered the paramedic, her tone brokering absolutely zero argument. Before Trent could scream at her, Dakota drove her knee directly into the patient's groin, pinning the femoral artery against the pelvic bone with brutal, precise force. The patient gasped a horrifying sound, but the fountain of dark blood from his thigh instantly ceased. "What the hell are you doing?" Trent roared, lunging forward to pull her off. "You're breaking protocol. You're going to kill him." Dakota finally looked up at Trent. Her gray eyes were dead black and completely devoid of fear. "If you touch me, Dr. Trent, he bleeds out in 30 seconds. I have the artery pinned. Get a combat tourniquet from my scrub pocket. Now." Trent froze. The absolute authority radiating from the small woman paralyzed him. He didn't move. "I said now, Mitchell," Dakota barked, dropping his title entirely. It was a command meant for a subordinate on a battlefield sharp enough to crack glass. Shocked into submission, Trent fumbled in her pocket, pulling out a black tactical cat tourniquet, an item not stocked in the hospital's civilian inventory. "Thread it high and tight on the thigh, above the laceration. Crank the windlass until the bleeding stops." Dakota instructed, her voice dropping back to that terrifying, calm cadence. Trent's hands were shaking, but he did as he was told. He cranked the rod. Dakota slowly eased her knee off the patient's groin. The bleeding had stopped. The patient was unconscious, but alive. "Ramirez," Dakota called out without looking back, scanning the rest of the room. "He needs O-negative blood uncross-matched. Push it through a rapid infuser." Trent, you have an open pneumothorax in Bay 3. The patient is cyanotic. He needs a chest tube, but you don't have time. Grab a 14-gauge needle and decompress his chest, or he's dead in 2 minutes. Trent stood there, his mouth slightly open, staring at the woman he had mocked just days prior. The timid, fragile nurse was gone. In her place was a phantom of the battlefield, a woman orchestrating the survival of a room full of dying civilians with mechanical, flawless efficiency. "Are you deaf, doctor?" Dakota snapped, her eyes locking on to his. "Decompress the chest. I am taking triage command. Move." Trent's hesitation lasted only a fraction of a second, but in the brutal arithmetic of a trauma bay, a fraction of a second was a lifetime. Dakota's command hung in the blood-scented air, sharp and unyielding. The sheer gravitational pull of her authority forced Trent's body into motion before his pride could formulate a protest. He snatched the 14-gauge angio catheter from the supply tray, his hands suddenly slick with cold sweat. He located the second intercostal space on the cyanotic patient's chest and drove the needle in. A sharp, violent hiss of trapped air escaped the pleural cavity. The patient's chest, previously locked in a deadly rigid barrel shape, instantly deflated. The frantic, high-pitched alarm of the heart monitor slowed into a steady, rhythmic beep. Trent stumbled back, his chest heaving, staring at his own trembling hands as if they belonged to a stranger. He had saved the man, but he knew with absolute certainty that he would have watched him die if Dakota hadn't broken him out of his paralysis. "Good," Dakota said, her voice entirely devoid of congratulations. It was a mere acknowledgement of a completed task. "Ramirez, secure the needle and prep a chest tube kit for when the OR frees up. Trent on me, Bay 5. Trent followed her blindly, the established hierarchy of Seattle Presbyterian completely evaporating. He was no longer the arrogant prodigy of the surgical wing. He was a foot soldier falling in line behind a battle-hardened commander. Bay 5 was a slaughterhouse. A firefighter who had been caught in the secondary blast of the industrial solvent explosion had been wheeled in. His turnout gear was melted to his left side, and a jagged piece of steel shrapnel the size of a dinner plate was buried deep into his abdomen. Blood was pooling beneath the gurney, dripping rhythmically onto the pristine white linoleum. Pressure is unreadable. The breathless EMT gasped, stepping back covered in the firefighter's blood. "He's in profound hemorrhagic shock. We pushed 2 liters of saline, but he's bleeding out faster than we can fill him. Cancel the saline," Dakota ordered instantly. "You're diluting his clotting factors. He doesn't need water. He needs blood. Ramirez, trigger the massive transfusion protocol. I want 4 units of O-negative, 4 units of fresh frozen plasma and platelets hanging immediately." Trent stepped up to the gurney, his surgical mind finally rebooting. He looked at the massive steel plate lodged in the man's abdomen. "The shrapnel is acting as a plug. If we move him, he bleeds out. We have to get him to an operating room right now to open him up. OR 1 through 4 are full," the charge nurse shouted from the central desk, holding a phone to her ear. "There is a 20-minute wait for an open table." "He doesn't have 20 minutes," Dakota stated, her eyes locked on the firefighter's pale, sweat-drenched face. "He doesn't have 2 minutes. His aorta is compromised. We are going to do a reboa right here." Trent's head snapped toward her, his eyes wide with disbelief. Reboa resuscitative endovascular balloon. Occlusion of the aorta was a highly complex, high-risk procedure. It involved feeding a balloon catheter through the femoral artery all the way up into the aorta and inflating it to completely stop blood flow to the lower half of the body, preserving blood for the heart and brain. It was a procedure reserved for the most elite vascular surgeons in fully equipped operating theaters. It was not something you did in a chaotic ER bay covered in soot and diesel fluid. "Are you insane?" Trent hissed, his voice dropping so the rest of the room couldn't hear his panic. "I've only assisted on 2 rebos in my entire fellowship. I can't do that blind in a trauma bay. If I rupture the aorta, I kill him instantly." "You aren't doing it," Dakota said, her tone as cold and hard as glacier ice. "I am." Before Trent could process the sheer absurdity of a trauma nurse attempting a master-level surgical intervention, Dakota had already ripped open a specialized endovascular kit, one she had personally requested, be stocked in the emergency department weeks ago, much to the administration's confusion. "Hold his leg steady," Dakota commanded. She didn't wait for Trent to agree. She coated the area with iodine in one swift motion, grabbed a scalpel, and made a flawless millimeter-perfect incision over the femoral artery. There was no hesitation. There was no shaking. Her hands moved with a terrifying mechanical grace. She wasn't just a nurse. Trent watched in stunned absolute silence as Dakota fed the guide wire into the artery. She wasn't guessing the depth. She was counting the centimeters in her head, navigating the complex vascular highway of a dying man without the aid of an ultrasound or fluoroscopy. It was an act of blind, instinctual brilliance that defied everything Trent knew about modern medicine. This was the Phantom of Dam Neck. This was the woman who had operated in the dust and darkness of undisclosed locations, a ghost of the elite DevGru Naval Special Warfare Development Group. She had performed this exact procedure in the back of a C-13, O Hercules under enemy fire, saving the life of a Navy SEAL who had taken a sniper round to the pelvis. Compared to the deafening roar of a war zone, the chaotic hum of Seattle Presbyterian was a quiet library. "Balloon is in Zone 1, Dakota announced quietly to herself. She attached the syringe and inflated the balloon. Instantly, the catastrophic flow of blood into the firefighter's abdomen ceased. The heart monitor, which had been erratic and fading, stabilized. The radial pulse, entirely absent moments before, returned as a faint, thready flutter under Trent's fingers. Dakota stepped back, dropping her bloodied gloves into the biohazard bin. He has 45 minutes of aortic occlusion before ischemic damage to his lower extremities becomes irreversible. Tell the OR they have 40 minutes to extract the shrapnel and patch the vessel. Now. Just as Trent opened his mouth, the double doors of the emergency department flew open, and Dr. Harrison Weber, the chief of surgery, stormed into the room. He had been pulled from a donor gala downtown, still wearing a tuxedo beneath a hastily thrown-on white coat. He stopped dead in his tracks, his eyes sweeping over the apocalyptic scene. 30 critically injured patients were triaged, stabilized, and systematically being moved. Chest tubes were in place. Tourniquets were secured. The mass casualty protocol was functioning with a ruthless symphonic perfection. Weber looked at Trent, his golden boy, who was standing frozen, covered in blood, staring in absolute awe at the quiet, mousy nurse from Bay 4, Mitchell. Weber breathed, stepping through the blood-slicked debris. "I thought this place would be a morgue. You orchestrated all this." Trent swallowed a lump in his throat, the size of a golf ball. He looked at Dakota. She was already moving away, quietly restocking a supply cart, as if she had just finished taking a routine blood pressure reading. "No, sir," Trent said, his voice barely a whisper, the ego completely stripped from his bones. I didn't. By 6 a.m., the adrenaline that had fueled the trauma center finally burned out, leaving behind a heavy, exhausted silence. The morning sun crept through the frosted glass of the emergency room doors, casting long gray shadows across floors that were currently being scrubbed by a silent janitorial crew. The scent of bleach violently battled the lingering metallic stench of blood. In the doctor's lounge, Mitchell Trent sat slumped on a leather sofa, staring blankly at a styrofoam cup of coffee. His scrubs were stiff with dried blood. His hands, usually so steady and arrogant, lay limp in his lap. His entire worldview, carefully constructed over years of academic praise and surgical triumphs, had been utterly dismantled in the span of 4 hours. The door opened, and Dr. Harrison Weber walked in, holding a thick manila folder. He didn't look angry. He looked profoundly shaken. "All 30 patients survived the night," Weber said, quietly, leaning against the door frame. "The firefighter is out of surgery. The vascular team couldn't believe what they saw. The Reboa placement was so flawless, they assumed a robot had guided the catheter. They asked me which attending performed it." Trent looked up, his eyes bloodshot. "It was Hayes. Dakota Hayes. She didn't just place the catheter, Harrison. She ran the entire floor. She commandeered my trauma bay, pinned a ruptured femoral artery with her knee, and commanded the room like she was leading a battalion." Trent ran a trembling hand through his hair. "Who is she? Because she is sure as hell not a private clinic nurse from Ohio." Weber sighed heavily, tossing the manila folder onto the coffee table. The file was stamped with bold red lettering, "Department of Defense, Restricted Access." When Human Resources ran her background check a month ago, it flagged as classified. Weber explained, pulling up a chair. "They assumed it was a bureaucratic glitch with the VA. It happens. But an hour ago, while you were all fighting to keep people alive, a federal liaison from Naval Special Warfare Command arrived at my office. Captain James Peterson. He came to hand deliver her unredacted credentials, simply because the hospital's security clearance didn't meet the threshold to view them digitally." Trent leaned forward, his heart pounding a strange, erratic rhythm as he stared at the folder. "What does it say?" "It says," Weber began, his voice dropping with reverence, "that Dakota Hayes is not just a nurse. She holds the rank of commander in the United States Navy. For the last 7 years, she was the lead medical officer for DevGru SEAL Team 6. Trent felt the air leave his lungs. He sat paralyzed as Weber continued. "She has completed multiple combat deployments to classified zones. She is trained in advanced battlefield trauma, tactical combat casualty care, and surgical intervention under fire. 3 years ago, during a highly classified extraction in a hostile territory, her team's helicopter was shot down. The commanding officer was critically wounded. Dakota performed a blind, in-flight thoracotomy and manually kept the officer's heart beating while returning fire until the secondary extraction team arrived." Weber paused, letting the immense weight of the reality sink in. "She was awarded the Navy Cross for her actions. She was personally commended by Admiral William McRaven. The only reason she is here in our hospital is because she voluntarily stepped down from active combat duty due to severe operational burnout. She took a civilian nursing job because she wanted quiet. She wanted to heal people without having to shoot someone else to do it." Trent closed his eyes, a wave of profound nausea washing over him. The memories of his own voice echoed mockingly in his head. "If you can't handle the sight of arterial spray," the The pediatric ward is looking for someone to hand out lollipops. You need to move faster. Trauma doesn't wait for you to find your courage. She can't handle trauma. He had mocked a woman who had seen more blood, more death, and more terror before her morning coffee than he would see in an entire lifetime of civilian medicine. He had mistaken her absolute chilling discipline for fear. He had confused the silence of a lethal elite operator with the timidity of a wallflower. "Where is she?" Trent asked, his voice cracking, entirely stripped of its usual bravado. "She clocked out 10 minutes ago," Weber replied. "She didn't wait around for a debrief. She just signed the charts and walked out." Trent stood up. He didn't know what he was going to say, but he knew he had to find her. He pushed past Weber and sprinted down the hallway, ignoring the strange looks from the morning shift staff. He burst through the double doors of the emergency room, out into the cool, damp Seattle morning. The ambulance bay was quiet. A fine mist of rain was falling, slicking the pavement. A few yards away, walking toward the employee parking structure, was Dakota Hayes. She wore a simple gray hoodie over her scrubs, a canvas duffel bag slung casually over one shoulder. Her posture was relaxed, her pace steady and unhurried. "Dakota!" Trent called out, his voice echoing across the concrete. She stopped and turned slowly. Her sharp gray eyes met his. There was no anger in them. There was no smug satisfaction or arrogance. There was only the calm, observant stillness of a woman who had faced the darkest corners of human fragility and survived. Trent jogged up to her, stopping a few feet away. For the first time in his entire career, the brilliant golden boy of Seattle Presbyterian had absolutely no idea what to say. He opened his mouth, but the words caught in his throat. He looked at her hands, the small, quiet hands that had just saved 30 lives with the brutal efficiency of a machine. Trent stammered, the rain dotting his glasses. "I saw the file. Weber told me." Dakota offered a small, polite, incredibly dangerous smile. It was the smile of a wolf pretending to be a sheep simply out of courtesy. "I'm a nurse, Dr. Trent," she said softly, her voice perfectly level. "I assist the attending physicians. I follow protocols. I do my job." "You saved that room," Trent whispered, his voice trembling with a mixture of shame and awe. "You saved me. I froze and you saved me. I mocked you. I treated you like you were weak. I am so profoundly sorry." Dakota studied his face for a long moment. She saw the shattered ego, the genuine remorse, the humbling realization of a civilian who had just brushed up against the terrifying reality of war. "In my previous line of work, Mitchell Dakota said, using his first name with quiet authority, 'We don't have the luxury of panic. Ego gets people killed. Loud voices don't stop bleeding. Competence does. You are a brilliant surgeon, but until tonight you were playing a game. Trauma isn't a game. It's a war." She adjusted the strap of her duffel bag on her shoulder. "You did well tonight, doctor. You followed orders," she said smoothly. "Now, if you'll excuse me, I have a very quiet apartment waiting for me, and I would like to get some sleep before my next shift." She turned and walked away into the gray mist of the Seattle morning. Mitchell Trent stood alone in the rain, watching the ghost of DevGru disappear into the shadows, knowing his hospital and his life would never be the same again. If you were captivated by this intense tale of hidden heroism and shattered egos, hit that like button to honor the silent warriors walking among us. Have you ever underestimated someone based on their quiet demeanor? Let us know in the comments below. Don't forget to share this incredible story with your friends and hit subscribe for more thrilling real-life drama narratives every week. Stay safe, stay humble, and keep watching.